Welcome to This Week in Pathology. This week we're covering 10 notable papers spanning diagnostic criteria and classification challenges, the expanding role of genomic and molecular profiling in tissue and cytology specimens, and the limits of artificial intelligence and integrated diagnostics. Let's dive in. We start with papers that ask whether our current diagnostic thresholds are drawn in the right place. In Virchow's Archive, a Dutch group makes the case that non-mucinous pulmonary lesions with adenocarcinoma in situ morphology can substantially exceed the 3 cm World Health Organization size limit. They completely embedded the affected lobe in 2 patients who presented with a pneumonia-like consolidation and ground glass pattern on computed tomography, 130 and 312 tissue blocks respectively, and found pure lepidic growth with no invasion anywhere, in tumors measuring 16 centimeters. They then went back to a nationwide cohort of pathological T3 node-negative adenocarcinomas larger than 7 centimeters and found 3 of 112 cases that were, on review, purely non-invasive lipidic proliferations, all with recurrence-free follow-up. The practical consequence is uncomfortable but clear. If you are going to call a large lipidic lesion invasive, that conclusion has to rest on adequate sampling, and for these cases that may mean sampling the entire lesion. Staying with diagnostic criteria, Modern Pathology reports the largest Asian cohort of spitzoid neoplasms to date, 140 lesions, mostly atypical Spitz tumors, with 8 Spitz melanomas and 6 conventional melanomas with spitzoid features. Malignant behavior tracked with asymmetry, deep atypical mitosis, sheet-like growth, diffuse PRAME positivity and loss of P16, which was absent in roughly 2/3 of malignant cases, versus fewer than 1 in 10 atypical Spitz tumors. Their most usable contribution is a refined fluorescence in situ hybridization threshold. Rather than relying on any single abnormality, requiring at least 2 aberrations gave complete sensitivity and about 92% specificity for predicting nodal metastasis or local recurrence. Isolated single changes, particularly MYB loss, were common in indolent lesions and should not be overread. Sequencing found initiating kinase fusions, or HRAS mutations, in about 90% of true Spitz neoplasms, including 5 previously undescribed fusions involving ROS1, E, ALK, and NTRK1, while the Spitzoid mimics lacked fusions entirely and instead carried conventional melanoma drivers. Malignant Spitz melanomas invariably had secondary hits in CDKN2AB, TP53, or CDK4, supporting a stepwise progression model you can actually use at the bench. The second theme is genomics extending what we can extract from routine specimens. In Cancer Cytopathology, a Japanese group asked whether residual liquid-based cytology suspensions, the ordinary leftovers from a routine cytology preparation, can go straight into the lung cancer compact panel without dedicated molecular preservation. Across 69 specimens, DNA integrity was generally well preserved, while RNA integrity was highly variable, and cyto-rich red fixation outperformed thin prep. Every sample passed the DNA-based assay, but about 1 in 8 failed the RNA module, driven mainly by low RNA yield. Among evaluable cases, concordance with companion diagnostics was close to 96%, with sensitivity around 92%, falling to about 89% if RNA failures are counted as negatives. The message for cytology laboratories is that this is feasible without special handling, provided you pay attention to fixative choice and cellularity, and that a negative fusion result on a low-yield sample deserves skepticism. In the Journal of Pathology, optical genome mapping was applied to 51 children with B-cell acute lymphoblastic leukemia and compared against karyotyping, fluorescence in situ hybridization, digital multiplex ligation-dependent probe amplification, and targeted RNA sequencing. Optical genome mapping agreed closely with conventional cytogenetics while uncovering complex rearrangements missed by standard methods in 15% of cases, including a complex KMT2A fusion, invisible to fluorescence in situ hybridization, and altered genetic classification or risk stratification in 1 in 10 patients. 2. Interpretive refinements mattered. Normalizing copy number values by DNA index improved concordance in near triploid and near tetraploid cases, and a new approach to the peripheral fringe zones of called variants improved agreement with digital multiplex ligation-dependent probe amplification. Notably, the methods were complementary rather than hierarchical. Some fusions in complex ETV6 RUNX1 translocations were missed by RNA sequencing and needed fluorescence in situ hybridization to confirm. Rounding out the molecular theme, the American Journal of Clinical Pathology reports the largest single sequencing cohort of anaplastic thyroid carcinoma assembled so far, 713 tumors from a commercial genomic database. 250 genes carried pathogenic alterations, 108 of which had not previously been reported in this disease, with MTAP the most frequent at just over 15% and co-deleted with CDKN2AB more often than earlier work suggested. Almost every single case, over 99%, harbored at least one alteration linked to a potentially actionable therapy. That is a hypothesis-generating figure rather than a promise of response, but for a tumor with so few options, it argues strongly for comprehensive sequencing at diagnosis. Modern pathology adds a transcriptomic counterpart in classic Hodgkin lymphoma, profiling 25 cases with a targeted immune oncology panel. Immunotherapy non-responders showed a proliferative, cytokine-activated but immunologically cold profile, with activation of E2F, G2M, MYC, and the PI3-KSO-AKT mTOR axis, and negative enrichment of inflammatory and interleukin-6/JAK-STAT3 signaling, whereas responders showed an inflamed microenvironment phenotype. With only 5 non-responders, this is preliminary, but the direction of travel, an oncogene-driven versus inflamed dichotomy independent of prior treatment, is worth watching. The third theme is where confidence in a diagnosis breaks down. Cancer cytopathology delivers a useful reality check on artificial intelligence in cervical cytology. 6 convolutional neural network architectures trained to separate negative cases from high-grade squamous intraepithelial lesion on isolated, non-overlapping single cells performed superbly in that setting, with areas under the curve from about 0.95 to 0.996. Applied without retraining to hyperchromatic crowded cell groups, precisely the pattern that trips up human screeners, performance collapsed with areas under the curve between roughly 0.39 and 0.68. Even the best architecture managed only 0.68. If you are evaluating a commercial cervical cytology algorithm, ask specifically how it was validated on crowded groups, because single-cell benchmarks do not transfer. Complementing this, Virchow's Archive reviewed 381 tumors sequenced through a precision genomics program and found histology genomics discrepancies in 9 cases, about 2.4%, driven by non-specific morphology and inconclusive or frankly misleading immunophenotypes. Low frequency, but concentrated in the hardest cases, an argument for integrated sign-out rather than sequential reporting. 2 further papers map difficult differentials. A systematic review in Virchow's Archive on distinguishing blastic plasmacytoid dendritic cell neoplasm from blastoid lymphoid and myeloid mimics, and from myeloid malignancies expressing plasmacytoid dendritic cell markers, and a human pathology series of 34 SMA-RCA, 4 altered malignancies showing that on cytology these tumors have no consistent morphology, are mostly adenocarcinomas rather than undifferentiated tumor percent. The practical caution there, SMA-RCA4 alteration is a prognostic marker, not a synonym for undifferentiated tumor. If you only have time for one paper this week, make it the Cervical Cytology Artificial Intelligence Study in Cancer Cytopathology. It quantifies exactly how badly published deep learning performance can overstate real-world capability, and that should shape how every laboratory interrogates vendor validation data. Here are the key takeaways from this week in pathology. First, large lipidic pulmonary lesions presenting as pneumonia-like consolidation may be genuinely non-invasive, so a diagnosis of invasion in these cases demands exhaustive sampling. Second, in spitzoid neoplasms, do not overcall a single fluorescence in situ hybridization abnormality, require at least 2, and add sequencing, since fusion status separates true Spitz lesions from conventional melanoma mimics. Third, routine liquid-based cytology residue can support comprehensive lung panel testing, but fixative and cellularity determine whether the RNA fusion module succeeds. Fourth, optical genome mapping adds clinically relevant information beyond karyotype and fluorescence in situ hybridization in pediatric B-cell acute lymphoblastic leukemia, changing risk stratification in roughly 1 in 10 children, while remaining complementary to existing assays. And fifth, artificial intelligence performance figures are only as good as the morphology they were tested on. Demand validation on crowded, overlapping cell groups before trusting a screening algorithm. That's your roundup for this week in pathology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And if you have a paper you have been meaning to read, upload the PDF or paste any link at audioscholar.cc. We will turn it into audio like this one, in any of 31 languages. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.